I've watched a lot of different TV shows and reacted to the medical scenes, and Charlie Sheen has had his fair share of health controversies. Let's check out 2.5 Men. Pee-whoop.
Sweetheart, I have to go. I have a patient. No, you just stay off your feet. Remember, you're very, very pregnant. Yeah, I love you too. I know we're gonna have a baby.
I always find it weird when doctors take personal calls. If my phone's ringing and I really need to answer it, I'll step outside of the room because it just feels like it's disrespectful to the patient. It might not be, but I just feel like it is. So I don't know.
So, Mr. Harper, you want a vasectomy?
Yes. You do that, right?
Of course we do. In the exam room next door.
It is an outpatient procedure, meaning that you usually don't have to stay overnight unless there's some sort of complication. In fact, there's 2 ways of doing a vasectomy. There's the traditional vasectomy where you go in, they do the incision, they locate the vas deferens, which is the canal that allows the sperm to pass through. They cut it, and then they usually cauterize both ends so that it doesn't reattach, although it does happen sometimes. In the no scalpel approach, they just make a little hole where the skin is stretchy, stretch out the skin, gather the vas deferens, cut it right there, seal it right there, and then put it back in where you don't have to put sutures in.
I just have a couple of pre-snip questions.
Shoot. Which, by the way, you'll still do post-snip, if that was one of your questions.
Well, good.
Of course, if I've done my job right, you'll be shooting blanks, yeah?
Not right away. In fact, it's recommended post-surgery to get a sperm count and analyze your semen just to make sure that there's no residual sperm still present. In fact, one of the leading reasons why vasectomies fail is that people have sex too soon after the procedure, where you could still have some residual sperm that can last like up to 25 ejaculations.
All right. Let's have a look.
We don't position patients' legs into the footrests. We ask them to put their feet in the footrests because when you do it that way, it comes off as aggressive.
Okay, all done.
That was quick. You got a little mirror so I can check out the back?
Not that little.
Come on, honey.
Those are fighting words.
Breathe with me, breathe with me.
Why is he wearing gloves outside of the room? We don't do that. You take off the gloves if you go outside the room. And I'm pretty sure the gloves should be sterile. Those are not sterile.
Okay, let's start snipping.
Naomi, could you get that for me?
Hello?
Where is the sterile gloves? Where is the chloroprep? Where is the cleansing of the region?
Anyway, as I was... Oh, God.
What's the matter?
My chest. Are you okay? I don't know.
Chest pain in his age group with shortness of breath as he's experiencing it is a 911 call.
Let's have a look-see, huh?
The rhythm on the EKG is absolute poo-poo. That's not real. He would be dead.
According to your tests, you just had an acute attack of indigestion.
I don't know what tests would confirm that. You could rule out that he had a cardiac issue, but you can't confirm that it was indigestion.
The good news is that you are a perfectly healthy 50-year-old man.
You can't say that just because you ran a few tests to rule out an MI.
I'm only 40.
Tell that to your liver.
Ooh. All handles.
Not so easy when I'm paying attention, is it?
Not so hard either.
Oh.
Ow! My head!
Oh, that's a head injury. Hitting the back of the head presents a lot of issues, especially when it comes to balance. Part of the brain that's responsible for balance sits right there in the back. And your visual cortex is back there as well.
Ah, you're gonna be fine. We just gotta stop the bleeding.
I'm bleeding?
The scalp does bleed a lot, so that's not necessarily an extreme reason to panic. More so if you're having neurologic signs, difficulty being able to see, weakness of the face, slurring of speech, unable to move your tongue appropriately, weird sensations in the arms or legs. In those situations, you want to move and be as still as possible and allow EMTs to come and transport you to the hospital safely on a backboard with a C-spine collar. I mean, his fall wasn't too hard, but the fact that he's bleeding definitely warrants an ER visit at the very least for staples. And we use staples on the scalp. It sounds terrible, but it's not that bad.
We need to see a doctor.
I just fill this out and have a seat.
No, you don't understand. He hit his head. He's bleeding.
Did he lose consciousness?
No, I got a little woozy, though.
A lot of people, when they see the sight of blood, they faint. Maybe it's like a protective mechanism.
Follow my finger. He's gonna be fine.
Whoa, that is not how we do a neurologic exam. We don't say follow my finger, eye muscles intact, good. There's other cranial nerves to check. Goes all the way up to 12.
Okay, you're gonna feel a little sting.
Nobody said I had to get a shot.
It's just to numb your skin so you won't feel the stitches.
What are you gonna give me not to feel a shot?
Sometimes we could use a cold numbing spray. If you feel cold in an area, that overwhelms the sensory nerves, whereby you might not feel as much pain when we do the injection of the lidocaine or whatever numbing agent we choose to use.
Go ahead, Doc.
Ow, ow, ow!
Hey, go easy on the kid.
No, you're squishing my hand.
There's also a good way to do it where off of a single injection, you can keep going amongst that spot so that you only feel one poke, even though you're doing it across a wider area. And I've kind of perfected that technique to make it less painful to do sutures, skin biopsies, shave biopsies, punch biopsies, all of these things. Once you perfect analgesia, it goes a long way, especially with pediatric patients.
How many stitches am I gonna get?
Oh, I don't know. 3 or 4?
That's all. Scott Pressman got 9 when his sister hit him with the Etch-a-Sketch.
I'm surprised they're doing sutures, not staples.
Help us out here, Doc.
Okay, I'll go 5, but one's purely decorative.
The staple doesn't work like a traditional paper staple where like it hits against the skull. It more so grabs the skin and kind of folds in and holds it together. Even the way we remove it is basically a tool that grabs the staple underneath and then another part that bends it. And when it bends it, it actually pulls it out of the skin gently.
Coming down.
Ooh, ladder injuries represent a whole segment of holiday issues. We gotta create a safer ladder, like a ladder that has an auto safety in it or something. I'm surprised a fall from that height only created a neck and hand injury. No hip, no leg, no rib? Seems sus.
I have abrasions, contusions, a severely sprained neck, 2 fractured fingers.
A severely sprained neck wouldn't necessarily require a C-collar like that. Oh, sneezing when you have a broken rib is the worst thing on the planet. Or low back pain, actually. I've had that happen to me.
Charlie?
What am I witnessing?
Do I look okay?
Sciatica?
What happened?
I pulled my back. Alan, you're a chiropractor. Do something.
Okay, let's see what we've got here. Is this tender?
A little.
On a scale of 1 to 10?
I don't know. 3?
Looks like he's palpating the thoracic spine, the lower thoracic spine, getting to the lumbars, maybe in the paraspinals, the muscles that surround the spine.
Okay, I'm better.
No, you're not. Now stop moving.
Really, I'm fine. Just don't. 10. That's a 10.
One of the tests that we do in a situation to diagnose sciatica is called a straight leg raise. And we see by stretching and aggravating the sciatic nerve if that reproduces symptoms.
Come on, let's get you back on the bed so I can give you an adjustment.
No. New plan. I need someone who can give me drugs.
And actually for sciatica, a lot of the things we do have pretty low evidence levels, but we have to do something. So very commonly we give over-the-counter medications like acetaminophen, which is Tylenol, or non-steroidal anti-inflammatories, Aleve, or Advil, Motrin, ibuprofen. Sometimes we give prescription ones like meloxicam. Other times we give muscle relaxers. Sometimes if there's very serious nerve pain, we can give steroids, which I try to avoid in many conditions. Physical therapy is my mainstay of treatment because that allows the nerve to calm down, helps secure the back. You can do mobility, you can do strengthening, and then work your way up to stretching. And then we always have, obviously, as a last resort, spinal surgery, but I'm very much not a fan of getting there unless absolutely necessary and the symptoms are that bad.
I could help you, Charlie. I've already isolated the source of your discomfort. All that's left would be to realign your vertebrae through a gentle series of manipulations and stretches, thereby alleviating your pain.
How does he know that it's due to a vertebral misalignment? That theory doesn't really hold up. It's been largely disproven, actually, in many of the instances. That's why, like, when people say your back pain is terrible because of your posture, it's like, is it because of your posture, or is your back pain bad, therefore you develop bad posture?
Did the pain start in your lower back?
Best I can tell, it's a spasm between L4 and L5.
That's not where he was palpating earlier.
Okay, I see here your last visit was 4 years ago, a mild hernia brought about by Okay, I think I'm seeing a pattern here.
You know what's interesting? As a side effect for, I don't remember if it was Viagra or Cialis, but it could actually cause very severe lumbar pain as a side effect. Because if you increase circulation and vasodilation to some of the specific veins of the back, it could actually create very severe back pain, and it's a known side effect. I wonder if that was the cause, especially given the fact we knew the history. That would be my next question if this was my patient.
So what's the course of treatment here? A pill, a shot, maybe one of those epidurals?
We'll see. First, I'm going to get your blood pressure and take some x-rays.
I don't like when we jump to x-rays for a non-bony issue. Like, it's very clear that this wasn't a bony problem, given the fact that he was laying down, there was no trauma. He clearly pulled his back muscle or has some sort of muscular or connective tissue problem. So if that's the case, let's treat it conservatively. Let's give him some time and see if it improves. Jumping to an x-ray is largely getting information that's not gonna help, definitely create potential harms, and the trade-offs just usually aren't worth it.
No fractures, no dislocations. Looks like just a simple muscle spasm.
Why would there be a fracture? I don't understand. He's a healthy young adult. Why? Why fracture?
Okay, I am going to give you a shot which should ease the pain and also allow your muscles to relax.
What kind of shot is this? Is this a Toradol injection?
Have you had Demerol before?
Hold on, isn't Demerol an opioid? Yeah, Demerol is a narcotic. Why in the world is she hitting him with a narcotic? This is clearly at peak opioid crisis days. We would never do this now.
Could you please wait outside? I need to give your brother a hernia exam just to make sure he hasn't re-injured the area.
A hernia exam.
Turn your head and cough.
Do you know why we do that? Because when you cough, you bear down, we could actually feel the hernia or the abdominal contents poke through the hernia if there was a hernia. Why the head turn? Because we don't want people coughing on us. On The Office, they did CPR. Let's judge them. Click here to check that out. And as always, stay happy and healthy.